Yeah, good morning, everyone. Today, I'm really happy to to host this session on reaching the COVID-19 vaccine target groups. COVID-19 pandemics have been, by its impact, unprecedented in the world because of it has shut down our activities, cut people from their beloveds, and really completely diminish our activities in all countries almost. From WHO last estimate, we have now over 1 million deaths around the world. And most of them were really the target group with elders and with medical conditions. To discuss this theme, we have convened 4 experts from global level and from 2 regions just to discuss how the vaccine that will be on track now, and we know that this vaccine will need some prioritization, how the target group that will be selected for this vaccine can be met. The 4 panelists are Adama Sawadogo, who is health specialist at UNICEF program division based in Copenhagen. He will be presenting the global perspective and some of the issues we have been discussing on how those targets can be met, knowing that each region will have its own specificities. And we have also selected Euro regions because of they have probably already some experience of vaccinating these targets. And Oleg, who is immunization officer at WHO Euro region, will provide some insight on the experience of the regions reaching the elders and what are the platforms that exist already in this region for vaccinating those populations. He will be followed by 2 panelists from African region. The first will be Serge Ganivet, who has long experience working with WHO and UNICEF, and currently supply chain officer in WCARO. He will be presenting what are the strategies and how in the African context they can be reaching those target populations. And then we'll conclude with Claude Mangobo, who is supply chain advisor at the regional office, who will be highlighting some of the challenges we may be facing reaching those populations. Without further delay, I will pass the floor to Adama for highlighting what are the global thinking here around those reaching those targets. Adama, the floor is yours.
Thank you, Mr. Solo. So the question actually I want us to think about is how the supply chain will play for COVID-19 vaccine deployment. We all know that to be efficient, the option of supply chain should be adapted to the type of vaccine to be delivered, the vaccination strategy to be implemented to reach the target population. But what do we know for COVID-19 vaccine so far? Still, some unknowns on the vaccine and the cold chain requirement are still, under discussion because we don't have the full picture of the characteristics. But what do we know for the scenario so far? We do know that to reduce mortality and protect healthcare workers and even the healthcare system in general, prioritized population groups have been defined. The first priority group is the frontline workers in health and social care settings. These are estimated to be around 3% of the national population. The second group is high-risk adults. We have adults over 65 years and adults with comorbidities, and this group is around 17% of the national population. So we can note that these groups are obviously not the standard group targeted by existing immunization program. in countries, be it routine immunization or mass campaign. So here today, I want to start the discussion on how to reach the two group of priority target group by looking at two contexts. The first context is the developing countries context. So this table presents the different target groups, the different priority target group, and the potential delivery strategy, how to locate and number the targets, how reachable is the target, and some comments. As you can see in this table, if you take the frontline workers, the potential delivery strategy should be the fixed site using the health facilities. But how to locate them, how to number them, robust and satisfactory micro-planning is necessary. We should list all health facilities. We should engage with professional associations and also the private sector. How reachable is this target? When it comes to frontline workers, health workers, I think that it's easier to track this target group. And we can estimate that we can even around 100% of this target, if not at least around 90%. But of course, we have to build confidence and promote the demand. The adults over 65 years, these are scattered in different sites. So we should think about fixed outreach and mobile strategy using multi-sectorial and coordinated approaches and different delivery sites. For example, you can think about the pension service, different ministries, villages, and so on. To locate and number these targets will be really a challenge. But if you go with a robust micro-planning, including hard to reach, nomadic, minority groups, with, of course, a clear community engagement, the families, the traditional leaders, the religious institutions, the civil society, the NGOs, and community-based association, I think that we can, reach a good number of this target, but it's not easy to track. It's difficult to track, and we cannot even estimate how much will be reachable. Here, we need to make sure that we run a good communication strategy and an awareness and address the hesitancy from the different group, including this one. The adult with comorbidity is the same, but here, I think that we should include in the micro-planning specialized healthcare institution. Use also for how to locate them, some patient support groups exist in different countries for different comorbidity, and use also the civil society and the NGOs should help us to locate and number the target. Here too, the target will not be easy to track, but it's a challenge, but we have to also run the specialized communication messages and raise the awareness and control and address the hesitancy of people fearing this vaccination with this vaccine. For developed context, this is another context. For developed countries context, going through the same type of analysis, you can see in this table, for frontline workers, I think we can have easily this population and even reach, if not 100%, at least over 90% of this frontline workers, using the health facilities and micro-planning through the list of health facilities, engaging health facilities and health workers, professional association, and also the private sector. For adults over 65 years old, I think here too, we have to think about fixed outreach and mobile strategies, but using, for example, the pharmacies, the doctor's offices, the large car parking areas, hit and run, transit points. This can be used as strategy to reach these over 65 years old. But also using emails to reach out to active adults, because these people can be joined by emails, but also using patient support groups, including the pharmacists, the retirement homes, the doctor's office, family doctor's office can also be used to locate and number this target. Here, we think that in this context, this target population can be reached, and we can even achieve over 90% of this target group. Of course, we should put a point to raise the awareness and also the communication to reach these people so that they come to this vaccination. For the adult with comorbidity, I think the same way we can use the doctors, the pharmacists, the retirement home, use active adults through, reach active adults through their emails as well. And we can hope to reach over 80%, if not 100% of the target. So these are just some thinking around how to reach these target groups. And I will conclude by saying that so far, if you look at since March this year, the COVID vaccine has demonstrated that to be effective, the community engagement is key. And it will also be key for the vaccination if we have vaccine available to do so. Delivery strategy and experiences from previous diseases like Ebola, like H1N1, and using innovative multi-sectorial and coordinated approaches and different delivery sites should be helpful to reach the priority target group. Here again, I will stress that critical is the community engagement in shaping the deployment strategy. Community need to be really involved and support the implementation. Also, we should think about how the deployment can integrate other health products to the vaccine delivery. Going to these groups, do we need or do we plan to have other products integrated to the delivery, the deployment, like therapeutics, like diagnostics? These are questions that need to be taken into account when we are planning for the deployment of a COVID vaccine. I stop here for just introducing the subject and for discussion.
Thank you very much, Adama, for mapping these potential strategies that can be implemented to reach these critical priority target group. Now we want to know the concrete situations, and I would like to call upon Oleg for giving how this is actually conducted in Euro country, in Euro context, as they have already probably experience of reaching this target population. Oleg, the floor is yours.
Thank you, Solo. In Euro, we have a broad range of countries. We have 53 member states across various income groups, geographical areas, various health systems, and definitely reaching those priority target groups for COVID vaccination is a question which we want to find answers to it as well. As a first step, we try to document, to find out what is the available experience to vaccinate adults. And from that perspective, we try to look at the published literature studies, but also look at available data through the annual joint reporting form. And that allowed us to identify the following. We found out that out of 53 member states in the region, actually 49 do have already vaccination programs for adults for various vaccines. We are speaking about influenza, tetanus, diphtheria, pneumococcal, and so on and so far. And it's quite a number of antigens which is delivered to adults across countries. Most prevalent is definitely influenza vaccination. So we could find that 48 member states do have in place vaccination policies for healthcare workers. And a same number also have influenza vaccination policies for adults with high-risk chronic conditions. And 42 member states also had recommendations for vaccination of residents in long-term care facilities. And that provides quite an important information that there are already ongoing programs in place, and there are ways how adults are reached with those vaccinations. So we try to identify what are those potential platforms. And the finding is that actually primary care physicians and nurses were the place where adults were getting vaccination in most of the cases. But we also had various other platforms identified, such as dedicated immunization services in several countries. We had vaccinations organized by public health institutions, in particular for adults. In a number of countries, we could find occupational health services, which in particular were dealing with immunization of health workers across a broader number of diseases. In Europe also, there is an expanding experience of providing influenza vaccination in pharmacies. And more recently, in particular, again, thinking about influenza vaccination, innovative approaches such as drive-through vaccination sessions in various places, in parks and recreational areas are practiced by some countries. It is also worth mentioning that there are issues which we also have to take into account with the current vaccination of adults. Monitoring coverage is a problem, and the big problem is defining denominators, and many countries actually are not able to monitor it. So we need to think about how to address it. And one of the very important findings which we have is low and suboptimal coverage amongst health workers. Health workers are going to be our first target priority group. And actually, experience shows that it's a group which is not easy to vaccinate. And also they have a role in promoting trust to vaccines and convincing other population to provide vaccination. So our experience in Europe is that we really have to pay much more attention to health workers, trying to make sure that they fully trust to vaccines, they accept vaccines, and they recommend vaccines to others. I would stop probably here outlining once more that it's very important to look out of the EPI box, to look at various other available services. We know in many countries, influenza vaccination, for example, is not managed by EPI, but by other programs. So it's very important to have this mapping of available services and resources in place. Over to you.
Thank you, Oleg, for highlighting really these experiences and these platforms that exist that can serve that. This is really will help probably to better reach the vaccination to these elders group. Now, I want to turn to Serge. I know that Africa is, especially WCARO region, we have country where we have rural populations, poor health systems. And the question is that how you will organize to vaccinate the elderly populations in this context?
Yeah, thank you, Mr. Chairman. Contrary what's happened in Europe, what President Oleg, in our African region, we do not have influenza vaccination program. So this group, the elderly and medical risk group, they're not usual for the target. They're not usual target for the API program. You know, we have some experience in some countries where we organize campaign like against polio or yellow fever for population up to 60, 65 years old. But to say the truth, we don't have much experience. So this is something we have to think about it. The LED groups, you know, what Adama said, you know, how to identify them, how to locate them. There was some structure where we can identify them, like the administrative service for pensions, the civil registry officers, the veteran associations, the play circles, you know, where they met to play games, or institution for elderly or retirement houses, you know. But what we have to know also is that this group, they're quite difficult to convince. It's not like the parents, when you want to vaccinate their children, they know already the advantage of the vaccination, they were vaccinated when they were young, you know. But this group, we need a strong argument to convince them to be vaccinated, to ensure that there is no side effect in regard to their age or to their illness. And above all that, we need to take time to discuss with them. It's not as with the parents, as I said, which is quite easier. But these people, we need to convince them, so we need to take much more time to discuss with them. The good thing is that usually, especially the radical groups, they do not move much, you know, from one place to another place. So it should be quite easy to meet them, okay? But they don't have access to the social media. Most of them, they're not linked, they're not connected to the social media. So that means we need to rely on community actions to sensitize, mobilize the notables, community, religious leaders, you know. And also, we have a good experience, we have good support from the community health workers that we use for the immunization program in all countries. They know very well their population, they know very well their area. They know how to give the message, how to, you know, to discuss with the community. So probably we have to think to brief them, to give them additional information, how to communicate with adults, because it's, as I say, it's something a little different. And for that, we may have to consider some perception studies for these target groups. That means that we need to understand what are the concerns, what are the issues. So in order to target the awareness, how to find the best messages to convince them to be vaccinated and to be sure that it will have an impact on the epidemiology context. The strategy, as present Adama, will depend on the characteristics of the vaccine that we don't know yet very well, the temperature, condition, etc., the dose, etc. But probably it will be a mix of different strategy, fixed, mobile, outreach, as it was mentioned, with a home visit for those with reduced mobility. So we need to consider the various strategies, the various sites. But as I say, with all the campaigns that we organize in the African region, we are quite familiar with this. We have a good experience on this, including, you know, with all the outbreak, different outbreaks that we have. So I think this is the key action point that we need to consider in our context to vaccinate these groups. Thank you, Mr. Chairman.
Thank you very much, Serge. I think, yes, I think it seems that there's still ways of reaching this population, provided that the elements you've highlighted are put in the organization and in the strategies to develop. But I want to turn to Claude to see that we assume that, yes, as Serge said, but there may be challenges. It may not be easy to vaccinate this population. Can you just highlight some of the challenges you were anticipating to face that you have to manage for that, for vaccinating this elderly? Claude?
Merci, merci Solo pour la parole. Et effectivement, la mise en œuvre de cette vaccination au niveau de la région va poser énormément de problèmes. D'abord pour la planification, et comme Adama a souligné dans sa présentation, il faut une bonne microplanification, c'est vrai, mais la microplanification sans maîtrise du dénominateur, ça risque de poser des gros soucis pour la mise en œuvre. Et donc, le premier élément qu'on doit absolument essayer de cerner dans cette vaccination, c'est la maîtrise du dénominateur, parce que c'est là qui va permettre de garantir l'accès à tous les groupes qui sont ciblés. C'est vrai que pour les personnels des premières lignes, ce sera un peu plus facile parce qu'on peut les identifier dans leur lieu de travail. Mais pour les autres groupes, ça ne sera pas une tâche facile parce que les personnes de plus de 65 ans, généralement, sont des personnes qui sont retraitées. Et donc, la plupart des cas, ils sont à la maison. Elles sont à la maison, ces personnes ne travaillent pas, elles sont à la maison. Et beaucoup ont également des limitations pour se mouvoir et donc difficile pour se rendre dans les sites de vaccination. Et donc, la question de planification est vraiment une question cruciale dans l'organisation de cette activité, de manière à ce qu'on sache qui doit être vacciné et où il faut le trouver. Ça, c'est une grande question qu'il faudra résoudre. Et dans les contextes de la région où il n'y a pas assez de maisons de retraite et la plupart des personnes de cette tranche d'âge sont dans les maisons. Et également pour les personnes avec des conditions sanitaires précaires, notamment avec des maladies chroniques. Également, c'est vrai, il y a des associations qui encadrent ces malades, mais il se pose un problème au moment de la mise en œuvre. Est-ce qu'on pourra clairement identifier ces personnes de manière à ce qu'elles reçoivent les vaccins quand le moment viendra? Parce que ces associations, certainement, ne retracent pas ou n'encadrent pas toutes les personnes avec des conditions sanitaires précaires et qui nécessitent l'accès au vaccin. Alors, un autre élément important, c'est à prendre au titre des défis, c'est la mise en place de la stratégie qui sera appropriée pour atteindre les groupes ciblés. Parce que pour les personnels de santé, on pourra facilement mettre en œuvre la stratégie fixe, mais pour les autres groupes, il sera très compliqué parce que les personnes de ces groupes-là, par exemple, les personnes
la technique, on n'entend plus Claude.
engagées, sinon on ne pourra pas identifier ces personnes dans leur lieu habituel, de manière à ce que des stratégies adaptées puissent être mises en place pour atteindre ces personnes. Parce que pour la plupart, peut-être le déplacement vers les sites de vaccination ne sera pas facile, mais probablement les équipes de vaccination vont se déplacer vers ces personnes afin de leur donner les vaccins. Et donc, cette combinaison des stratégies est un des éléments importants qu'il faut que les pays puissent bien penser et bien mettre en place afin que tous les groupes ciblés ou toutes les personnes ciblées puissent réellement
la technique. We have
est-ce qu'ils feront quoi? La stratégie avancée, la stratégie fixe avancée, ça sera de la stratégie mobile, c'est du porte-à-porte. Alors, il faut une logistique adaptée pour chaque type de stratégie qui sera mise en place. Et je ne pense même pas que dans la planification, cette question pourra être bien traitée. Donc, il faut vraiment une implication des ciblées. Il y a des associations des diabétiques, il y a des associations des personnes vivant avec les VIH ou des malades de cancer. Et toutes ces organisations devront être identifiées parce que probablement elles doivent jouer un rôle très important dans l'identification des personnes ciblées pour cette vaccination. Et donc, très important pour nous d'organiser la distribution des vaccins dans les sites qui ne sont pas conventionnels. Ça, c'est un défi également parce que la vaccination, jusqu'alors, c'est au niveau dans les systèmes de santé. Tout est organisé dans les systèmes de santé. Alors que pour le cas de cette pandémie, la vaccination devra aller au-delà du système de santé. On devra penser, et également, j'ai aimé ce que Oleg a dit, on doit penser en dehors du système de vaccination. Comment est-ce qu'on pourra organiser les activités? Ce n'est que de cette façon-là que nous allons peut-être surmonter certains défis, notamment liés à l'accès aux personnes avec des problèmes de santé qu'il faut localiser là où elles vivent et aussi les personnes âgées. Et donc ça, c'est un gros défi qui nous attend pour l'organisation de cette vaccination. Alors, un autre élément important également, c'est l'organisation de la chaîne du froid. Parce que nous connaissons la faiblesse dans notre système de santé et en particulier dans les secteurs de la vaccination, où la plupart des pays ont fait des efforts, certes, mais il y a encore des gros challenges pour maintenir la chaîne du froid à un niveau adéquat. Et donc, ne connaissant pas les caractéristiques des vaccins que nous aurons à utiliser pour cette vaccination, l'organisation de la chaîne du froid devient un maillon à prendre vraiment avec beaucoup d'attention, de manière à ce qu'on puisse assurer que les vaccins qu'on administre est un vaccin qui est bien conservé et qu'à chaque niveau de la chaîne d'approvisionnement, un type d'équipement de chaîne du froid approprié est disponible afin d'assurer une bonne vaccination. Ça peut être des glacières à longue durée de conservation, des porte-vaccins avec suffisamment des capacités pour transporter des doses importantes des vaccins et atteindre les cibles. Il y a un autre challenge également auquel on doit s'attendre, c'est l'enregistrement du vaccin dans les pays. Comment est-ce que les pays, à travers les NITAG, à travers les comités scientifiques, vont gérer, n'est-ce pas, l'aspect de ce nouveau vaccin qui va arriver et pour lequel beaucoup de pays ne sont pas encore préparés, ne connaissant pas les caractéristiques, la formulation, les informations critiques sur ces vaccins ne sont pas encore connues et donc les pays devront être appelés à accepter ce vaccin. Et donc, comment est-ce qu'ils vont pouvoir s'organiser pour notamment l'enregistrement des vaccins dans les pays et sa mise en circulation? C'est également un challenge que les pays, un défi auquel les pays seront confrontés et que certainement au niveau global, des groupes spécifiques comme les Serge devra penser comment est-ce que les pays devront surmonter ce défi. Parce que ce sera un réel problème auquel les pays seront vraiment confrontés. Et un autre défi également que je trouve également non moindre, c'est l'organisation de la communication, notamment avec l'implication des autres secteurs. Parce que pour réussir cette activité, l'implication des autres secteurs, notamment le ministère des Affaires sociales dans certains pays, ou les ministères qui s'occupent de l'encadrement des personnes de troisième âge, mais aussi les associations ou des organisations non gouvernementales qui appuient les activités relatives aux maladies non transmissibles et pour lesquelles certaines personnes seront des cibles pour cette vaccination. Et donc, comment faire en sorte que la multisectorialité soit bien mise en exergue de manière à ce que ça ne soit pas le problème du secteur de la santé seul, mais que tous les secteurs qui sont intéressés de manière à ce qu'ils puissent faciliter l'accès aux populations cibles soient réellement impliqués. Ça, c'est aussi un gros défi dans la mise en œuvre de cette vaccination. Quel rôle que chaque secteur va jouer de manière à ce que les énergies soient fédérées afin que la vaccination des personnes de ces groupes ciblés puisse se faire avec facilité et atteindre les couvertures estimées, comme Adama a dit, pour certains groupes jusqu'à 90%. Voilà un peu les quelques problèmes qui nous attendent et auxquels nous devons apporter des solutions pour que les pays réussissent la mise en place de ce vaccin. Merci à vous.
Merci beaucoup, Claude. I think we have made the listen all the presentation from our panelists. I thank them. I think we have a full overview of the question from the global perspective, where the potential strategies were highlighted by Adama for the different groups and the potential strategies that can be mobilized here and here, depending on the context, followed by Oleg, where he has really highlighted the concrete examples of the region, Euro regions where platform and experience exists for the elderly vaccination and health workers. And finally, Serge and Claude has highlighted both how they can organize, maximize the experiences of individual activities, immunization activities they have conducted to reach those elder population to organize the vaccination for COVID in the African context. And they have highlighted the challenges, stressing the need for non-conventional conventional strategies, and also probably try to develop better and rely on mobile cold chain just to reach these populations. And I think that here we can just open the floor for questions and discussions. Okay, thank you. Thank you all. I've seen that we have a lot of comment on the chat, where really I think you have been sharing your experience and your comment. I can see here a lady, I think in South Sudan, provided that some of the need for strengthening the communication, because this is a new target population that we, at least in some countries, that is not yet used to be vaccinated by immunization programs or campaigns. Communication will be a key thing here. Our colleague in Naim in Pakistan has highlighted, based on the huge number of target population that will be vaccinating there, if there will be a possibility of splitting into different batches for the vaccination. And I think that this element will be discussed actually, because WHO is leading what we call the prioritization groups. And with UNICEF, I think there should be a way of harmonizing and getting the different batches, taking into account the cold chain capacity in the country to accommodate if 2 rounds are needed, if not possible, just maybe by round or by different segment of this population, health worker first, and then the 17 later on. So there were another question regarding, are we going to limit to these health worker and elderly? I think I want to ask probably one of our panelists, Adama or Oleg, what is actually proposed? You have targeting only these two populations. Are we, other people will left out, Adama?
Thank you, Chairman, and thank you everyone for the this interest on this topic. It's really a huge topic because we need to reach the target population. Talking about target population, actually, there is let's say the allocation of vaccine through the COVAX facility is really aiming at protecting strengthening the health system in the country, and so that it can impact on the morbidity, the COVID mortality, I would say, mortality. So to reach this goal, actually there are two main priority target group that are first targeted. Actually, the first these two main target group, these two priority target group are first the frontline workers. These are the health workers and also social care workers. Again, to make sure that we keep our health system strong enough by protecting these people so that they can also provide care to other people. The other one is the elderly. By elderly, we understand two groups of people here. The first is the adult over 65 years old, and any adult with comorbidities. So the idea here is we think, and it has been actually observed, that these target group are the ones that suffer the most from the COVID, and then to protect them, we have really to make sure that they are vaccinated as priority group. Of course, beyond these two groups, we can go beyond depending on the availability of the vaccine, but also depending on actually what each country define at the end of the day, which are the priority groups that should be targeted in the country. But the recommendation is strongly to target the frontline workers and also the elderly. Over.
Thank you, Adama. I want to call Serge. One of the participants is asking that, I know that Claude has highlighted the challenges in English, and I know that you have also contributed to that, highlighting the challenges in the African context to reaching these elderly populations. If you can just summarize in 3 words, what were the key challenges that Claude has highlighted?
You asked for me?
Yes.
Yeah.
In English, they were saying that Mohamed was asking in English.
Yeah. Thanks. The main challenges that we may have in our region, African region, and probably in some other regions, is that we don't have a program like in Europe. We don't have yet a program that that target this population, especially the elderly groups. So that's mean that we don't know the denominator. So that's why we say that the challenge will be to denominate, to estimate the number, but also the location. Where are they? And how to identify them, how to reach them. So there will be a macro planning, and the macro planning, we need to invite different actors to give us some data, some information, where are those people. That's one of the challenge. The second challenge is also the distribution. So this is the key, and that will be part of the macro planning, is the application of the denominator and also the location, and now the transportation for the vaccine.
Thank you, Serge. Olivier is insisting on the role of, if the panelists, we can elaborate on the role of private sector in reaching this population. We know that even in developing countries, more and more elderly especially are going to the private sector for curative care. And I will ask first Oleg just to highlight what you'll be anticipating in the region that these service providers, health workers can be instrumental on reaching this population. And then we'll ask Claude and Serge to provide the insight on this in the continent, African continent. Thank you.